So moving to the stroma and the microenvironment targeting for pancreas adenocarcinoma, and just a reminder again that this stroma is characterized by a relative absence of epithelial malignant cells and a predominant presence of stroma, which is composed of hyaluronan and glycosaminoglycans, and this provides a physical barrier and may inhibit drug resistance. A pegylated hyaluronidase enzyme has been shown to degrade the stroma, to alter the physiology and dynamics from the vascular perspective, and to facilitate drug delivery. And this approach has been taken to late-stage clinical development in pancreas adenocarcinoma following early promising signals. These data were fully published earlier this year, looking at the addition of pegylated PEG-PH20 combined with gemcitabine and nab-paclitaxel and compared to gemcitabine and nab-paclitaxel for patients with untreated advanced disease. And looking here at progression-free survival, looking at thromboembolic outcomes, and then there was secondary analysis by hyaluronan level as adjudicated by tissue immunohistochemical analysis from a baseline biopsy or archival tissue. And looking at the principal outcome of progression-free survival, you'll see for the overall cohort there was a improved outcome, but I want to draw your attention to the subgroups of patients who had an elevated level of hyaluronan. This group of patients appeared to have a particularly promising potential advantage for the addition of PEG-PH20 to standard therapy, and we'll see how this translates going forward. During the conduct of this study, it was paused because of early on and excessive thromboembolic events that were noted in the triplet combination arm, and this resulted in a primary prophylaxis strategy where patients were initiated on low molecular weight heparin. And you'll see for the stage 2 patients, though, after the hold and reopening of the study, if you look at the bottom line here, you'll see that thromboembolic event rates were sort of neutralized with the addition of low molecular weight heparin. And this has now become standard practice for studies that are underway with this particular combination. And the key study for which we'll hope to see results sometime later in 2019 is the HALO 301 trial. And this study is being conducted in a biomarker-selected subgroup of patients with elevated levels of hyaluronan and looking at primary outcome of overall survival. And this will enroll in terms of its recently updated statistical analysis will enroll approximately 500 patients. So we look forward to seeing these data. I do want to draw your attention to an evaluation of modified FOLFIRINOX with PEG-PH20. This was a randomized phase 1b, a randomized phase 2 that was conducted by the SWOG cooperative group. And this yielded some surprising results. So firstly, the control arm did well and did better maybe than even the original phase 3 had suggested, and that's important as this was across a swath of community and academic sites. That part was good. The part that was disappointing and unexpected was that for the group of patients who received modified FOLFIRINOX and PEG-PH20, their outcome was inferior to standard therapy alone, with a median survival of 7.7 months. And unclear whether this was related to the higher rates of toxicity which were present for this particular combination. This was not a biomarker-selected group, and we're hoping that there may be some retrospective analyses that will be able to further inform the observations of this study. But the key kind of take-home point here is that PEG-PH20 and FOLFIRINOX do not go together at this juncture.